Good day everyone, my name is Sherilyn Delajero from Basin 1B, and for today's video, I will demonstrate to you hygiene return demonstration. Hygiene is a conditions or practices conducted to maintaining health, preventing disease, especially through cleanliness. And its purpose is to make the client clean and feel comfortable. The second one is to increase sense of well-being, and the last one is to promote muscular relaxation and relieve feelings of fatigue. The equipment of the hygiene is the wash basin, the bath blanket, the bath towel, washcloth, patient gown, hamper for soiled linen, gloves, the soap, and the hygiene supplies lotion or powder, and deodorant or bedpan urinal. So first, we perform a bed bath, and that's the first procedure. Assessment. Assess client's tolerance to activity. Assess room temperature and ventilation. Planning. Don't forget to wash hands. Gather all necessary equipment. Implementation. Identify the client and explain the procedure. Provide privacy. Adjust bed to a comfortable working height position. Place bath blanket over the client before removing tap. Remove client's gown, ensuring he or she is covered with bath blanket. Pull side rail up and fill basin with warm water. Place client in semi-folders position and remove the pillow if permissible. Make a mat of the washcloth. Wash client's eyes from the inner canthus towards the outer canthus. Wash client's face, ears, and neck, rinse and pat dry. Wash arm for from U, distal to proximal including axilla, using long firm strokes, rinse and dry. Repeat the procedure on the arm near you. Wash client's hands in basin, rinse and dry. Expose one leg at a time and wash leg far from you with long firm strokes, rinse and pat dry. Repeat procedures on the leg near you. Immerse and wash clients' feet and basin, rinse and pat dry. We need to replace water. Turn patient on his or her side and place towel alongside of the back. Wash the back and buttocks with long firm strokes and rinse and pat dry. Place the client in supine position and cover with bath blanket, and then wash the perineal area, rinse and pat dry. A patient is able to place a towel under the buttocks and bring basin and soap within client's reach. Instruct clients to complete the bath him or herself. Have the client wear a new gown and comb hair. Apply lotion if desired by a client. Remove equipment used and store them in a proper place. Then don't forget to wash hands. Sponge bath. So the sponge bath is use of a wash basin filled with the cold or the tepid water to sponge the client in order to dissipate heat from the body through conduction and vaporization. So the purpose of the sponge bath is to reduce an elevated body temperature and to make the patient comfortable. So the materials and equipment is number 1 is basin, number 2 is the washcloth, and number 3 is a towel, and number 4 is the bath blanket, and the last one is the gown. Then, determine the need of the client. Planning. Don't forget to wash hands. Number 3 is assemble equipment needed. Implementation. Identify and explain the procedures to the client. Take the client's temperature. Fill basin with the water at appropriate temperature about 29.5 Celsius to 32 Celsius. Drape the client with bath blanket and roll top sheet to the bottom of the bed. Remove patient's gown, exposing only the areas to be bathed. Sponge the client's face and forehead with plain water. Do not dry. Place cool, moist washcloth and axilla ongoing. Remove with the start to dry. Sponge and massage body area and rotation. Neck, arms, legs, and back. Moisten them for several minutes, but do not dry after sponging. Reassess client's body temperature and pulse after 30 minutes. Discontinue bath when desired temperature reach, usually lasting for 20 to 30 minutes. Pat the client dry when bath is completed. Place client in a comfortable position. Put on a clean gown on the patient. Remove equipment used and wash hands. Evaluation: receives body temperature, and the documentation is a record the type of procedure rendered, body temperature, and client response. Hair shampooing. The definition of hair shampooing is cleaning the hair by removing oil and dirt with the use of the shampoo while patient is on bed. So the purpose of it is to clean the hair and improve the patient's well-being. The materials and equipment of the hair shampooing is the bath and blanket, rubber sheet, 2 pails, shampoo, cotton balls, 2 bath towels, Kelly pad, pitcher, and warm water. Assessment: check doctor's order for hair shampoo. Assess the patient's condition, like manifestation or fatigue, level of consciousness, and hygiene needs. Determine the need for assistance. Gather all the equipment needed. Implementation: identify the patient and explain the procedure. Provide for privacy. Raise the bed to proper working level. And don't forget to wash hands. Shampoo here as follows. Unfold the top linen to the feet and position in the bath blanket over the patient. Position the patient diagonally in bed. Place the cotton balls in each air fold. Cover the eyes with folded washcloth. Place a towel around the patient's shoulders and neck with the ends of the towel coming together in front. Place a Kelly pad under patient's head. Wet the hair and using a small amount of shampoo, lather it on hair and massage the scalp with fat pads of the fingers. Rinse thoroughly and apply cream rinse as desired by the patient staff. If the hair is dirty, remain the step. Rinse thoroughly, remove the Kelly pad, pull the towel around. Patient's shoulders should dry the hair. Comb and brush and arrange the hair or allow the patient to assist if able. Remove the rubber sheet and other equipment and place patient in comfortable position. And don't forget to wash hands. Evaluation. Watch the patient carefully for signs of fatigue and evaluate as to comfort and cleanliness. Documentation. Record the procedure done. Back rub. Definition. A therapeutic massage done at the back of the client to provide comfort and allow to the care provider an opportunity for the skin assessment. So the purpose of the back rub is to provide comfort to the client, stimulate circulation and relieves muscle tension, and facilitates therapeutic effects. So the materials and equipment of this is lotion or baby oil, soap, towel, washcloth or basin with warm water, and the bath blanket. Check the chart for information related to client's ability to participate in procedure being planned. Assess vital signs. Determine assistance needed. Determine obtain articles needed. Implementation. Identify client. Explain the procedure to the client. Ask preference of rubbing agent. Provide for privacy. Maintain a quiet and relaxing atmosphere. Move the client near to your side and position. If the client is able to move, instruct her or him to assume sitting prone position. Wash dry back if necessary. Pour a small amount of rubbing agent into hands and rub hands together. Place hands sacral area while maintaining good posture. Make long firm strokes towards shoulders and back towards buttocks. Move hands towards neck and rub neck. Continue rubbing outwards across the shoulders. Moves hands downward to scapula and massage in circular motion. Rub into figure 8 pattern and buttocks of sacral area. Complete back rub by moving from shoulders to sacrum and back shoulders. Remove excess rubbing agent used with towel. Reposition client and replace the linen. Raise the client and replace the lining. Raise side rails and place towel light within reach. Return articles used in the storage area. Wash hands. Evaluate in the terms of the following criteria: A. Fatigue. B. Subjective feelings. C. Objective appearance of the comfort. Documentation. Clients respond to background